Hello and welcome to Hudson Health. My name is Dr. E.J. Akunyili. I am Chief Medical Officer at Jersey City Medical Center, a division of RWJ Barnabas Health. I'm excited today to have a very special guest, somebody who I've known for a while and who is an excellent physician and cardiologist in our community, and one of the leaders of cardiovascular care in this community. Dr. Pragnesh Gadhvi brings many years of experience treating patients right at home here in Hudson County. He is also an educator, teaches residents, fellows, and has been a leading voice in our community for the treatment of hypertension. He brings his expertise in managing this very serious and common illness in the community to us today. We're very excited. We're going to talk all about high blood pressure or hypertension, how to detect it, screen, manage, prevent, and long-term continue to lead a healthy life. RWJ Barnabas Health is committed to having this Hudson County be healthier together. Please join me in welcoming Dr. Gadhvi, and very excited to have him throughout the show to discuss all things hypertension.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Hello and welcome back to Hudson Health. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a division of RWJ Barnabas Health. Today we're going to be with Dr. Pragnesh Gadhvi and discuss all things heart health and hypertension especially. Now, all of us know somebody, a friend, a family member, a colleague, a parent who probably has hypertension. Heart disease, as we discussed, is one of the leading killers in the United States. Today we do want to do a deep drill into heart disease and hypertension. What are the causes of hypertension and how can we prevent it? In today's very sedentary world, how can we do things like more movement? Are there ways to improve our diet? And when all that sort of fails on the first pass, what are the ways to treat hypertension with medication? Very excited because Dr. Gadhvi is an expert in different medications and how different medications work for different patients. We're going to have him today explain in layman's language what medications are best, what other interventions besides medication work in hypertension when it's refractory to medications. But something that we don't talk about a lot is the role of stress. We'd like to talk about stress, sleep, or lack thereof, something that's near and dear to many of our hearts, and diet. All these things that are part of sort of our industrialized world that may lead to hypertension if we don't manage them appropriately, would like to discuss with Dr. Gadhvi. Again, we also, just back to what we do on the show all the time, want to talk about education. How do we educate patients on how to take good care of themselves so that they can prevent hypertension or maintain their blood pressure? Here at Hudson County, we want to make sure that our population has access to the best care and the best doctors. So we're going to be talking a lot about access. Where can somebody go if they have a question about their blood pressure? Where can they get care? How soon can they get care? And what is the best way to continue making sure they're healthy? And then finally, we want to look at things like exercise. Exercise is one of the leading indicators of whether you're going to develop high blood pressure or not. What exercises are best? How much is enough exercise? Is it 10,000 steps or 8,000 steps? So very excited. I've known Dr. Gadhvi for a while. He brings a wealth of experience. His patients love him. Here at RWJ Barnabas Health, we want to make sure you have the same access to our world-class experts as we do every day. Now, some of you here may think, I don't have enough time to think about this. And we know that we live in a very busy world, but I urge you to please stay, listen to the whole show, and make sure you connect with one of our network of excellent providers in the area for any further questions.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712. Burns Brothers, Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers, Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyili. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. I have the extraordinary pleasure of welcoming Dr. Pragnesh Gadhvi today, Director of Clinical and Ambulatory Cardiology, Jersey City Medical Center. Welcome, Dr. Gadhvi.
Thank you, EJ. It's a pleasure to be back.
Of course, also world-renowned cardiologist. Really excited to have you. So as I told you, we're going to talk about all things high blood pressure, but let's not assume that everybody sort of knows. Everyone knows somebody that has high blood pressure. I said it in the opening, a family member, a friend, a parent. But what exactly is hypertension in layman's terms for people watching at home?
Sure. So high blood pressure are two things. Number one, high blood pressure is a risk factor. meaning that having high blood pressure in itself predisposes you to conditions that can affect your heart, your circulation, the brain. It can affect your kidneys. It can affect your vision. Not only is it a risk factor, but it's a disease. And it's an important disease because it's very simple and easy to treat if we all work together. High blood pressure is defined as the blood pressure that your arteries create when the heart squeezes. And there's two numbers to make note of. What we talk about the heart squeezes and it contracts, and that squeeze causes the blood to flow. Just like you're opening up a faucet. If you want to increase the flow, you open up the faucet and you get more water coming out. The pressure that it exerts on the blood vessel walls is called your systolic blood pressure. And then when the arteries relax, that's called your diastolic blood pressure. So the real true definition of high blood pressure is any level above 140, your systolic, and a level above 85, your diastolic. That is defined as high blood pressure, but we've learned that even that is considered elevated in some people.
So ideally, we think of 140 over 85, but if somebody's sitting at home and saying, well, I don't want to get to that high level,
Exactly.
What are the newer recommendations of an ideal place to be in?
Of course. And one thing that you pointed out is that, yes, somebody at home may have high blood pressure, and we want to know. What's really astonishing is that 1/5 of the world's population has high blood pressure. If we take that as a number, it's 1.3 billion people in the world that are affected by high blood pressure. If we bring it home, 50% of the people in the United States are affected with blood pressure. That's one in every person. I don't have to have you look left and right to find the person with blood pressure. You just need to look at one direction and you found the person that has high blood pressure. So the prevalence of high blood pressure is very high in the United States. There are different levels. The best level that we need, what we would consider ideal high blood pressure, and I'd like to also say that we, as a community, sometimes have forgotten what the normal is. We really don't know what normal. I mean, we go to restaurants and, the Western diet and the food culture now. We have big portions, large portions. Blood pressure, for it to be ideal, is technically less than 120. In between 100 to 120 as your top number is considered a normal blood pressure, whereas some people feel that that's too low for them. But believe it or not, that is considered a normal blood pressure, and every 10 or 20 point increase doubles and triples your risk of developing the complications of high blood pressure, which could mean stroke, which could mean heart attack, which could mean kidney disease, and could even lead to blindness if left untreated.
I think your point is so well taken that not only is this such a disease that leads to so many other downstream effects, but it is completely preventable in many ways.
Absolutely.
Or at least to some extent. So
Absolutely.
let's talk a lot about the prevention, because you have this disease as one in every other adult.
Mm-hmm.
To your point, as an emergency physician, I don't see 120s very often anymore. How do we prevent this, such a big problem? And I'm sure it is Hudson Health in the Hudson community.
Absolutely. The Hudson County has a population of about 700,000 or 800,000 people. Just imagine, every year in the United States, in fact, 2022 alone, there were 800,000 deaths that were attributed to people that had solely high blood pressure. That's astonishing. What do? I think first and foremost, our organizations, our community, our hospital, our healthcare officials, we've all worked together to try to sort of build teamwork. And the teamwork is not only from the patient, from the community, from the churches, from our schools, from our hospitals, from our social care services. We're trying to build a network of people that can help raise the awareness for high blood pressure. If you go to the American Heart Association's website and look at Life's Simple 7 Rules, and this is beautiful. 7 simple things that you can do can reduce your risk of diabetes by 75%, can reduce your risk of heart attack by as much as 50%, can reduce your risk of developing high blood pressure by 50%. What are those 7 simple things? We can start off by 3 things that we can change. We can eat better, we can exercise more, we can stop smoking. What are 4 things that we can lower? We can lower our blood sugar, we can lower our sodium intake, we can lower our weight, and we can lower our blood pressure. If you do even 3 or 4 of these things on a regular basis, we're talking about as much as a 50% reduction, and that is free. There's no cost to that. And if we all teach each other how we can do that better, I think that we can have a far healthier community much faster.
I completely agree with you. And as a community of healthcare practitioners, not only are we teaching this, we're advocating for policies, whether it's having a food pharmacy or working with our governments or having pantries that make it easy for people to make this easy lifestyle decisions. So once we sort of go past the primary prevention, tell us what's the role of medication when people finally come in and, the lifestyle medication interventions have not quite taken them where they need to be. What is the role of medication?
Role of medications are very important. I mean, we have to understand that the prevalence of high blood pressure, and now we know it's not only a risk factor, but it's also a disease. So how do we treat high blood pressure? Medications are the first and foremost pillar of treatment for high blood pressure. In the United States alone, we know that 50% of the people have high blood pressure, but it's surprising to know that only 20% of them may be on a medication. Some are not. In fact, 20% of them are told just healthy lifestyle, diet, exercise habits, and sometimes they don't work out. Whether or not it's because we don't emphasize the importance of it, and sometimes culturally it's just difficult. I mean, we live in a fast-paced world where a lot of times we can't get to the gym, we can't exercise, we're stressed. And everybody knows, I mean, how many times do we have a stressful situation and we have a conversation, we say, you know what? I was so stressed, my blood pressure must have been to the roof. But it probably was, right? And this can harm us. Medications are important, and we usually lump medications into classes or buckets.
So let's come back, because I do want us to spend a lot of time talking about medication.
Sure.
So we'll be right back and we'll talk about the classes of medications.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Welcome back to Hudson Health. I have with me Dr. Pragnesh Gadhvi, who we're talking about all about medications and classes of medication for high blood pressure.
So we know that there's so many brands out there of blood pressure medications, but in general, medications fall into sort of buckets or classes. Each class is meant to treat blood pressure in a way that is effective. Not all medications are effective for all people. A good history, a good evaluation with your primary doctor, with a cardiologist, with a specialist will allow us to sort out which medication may be right for you. And the example that I like to give is, if we're sitting in a house and we want to be secured and we want to be protected, we need to lock the windows, we need to lock the front door, we need to lock the back door, we need to lock the basement. So it's rather important to know that one medication may not be best. And in fact, newer evidence is suggesting that the best type of treatment is to be on what we call polypharmacy, where we may need to use 1, 2, or 3 different medications. And the advantage is that we can keep these medications at low doses, but we're impacting blood pressure in a much broader and better way.
That's interesting. So just thinking of multimodal treatment of blood pressure. To stretch your analogy, it's not just medication, but also bringing back those lifestyle changes that all adds up. So it's not one or the other. It's really thinking about all of them holistically to help the patient. And any, without getting too technical, any particular medication class in different people?
Sure. So in general, when we refer to blood pressure medications, we may hear the terms beta blocker. Beta blockers are medications that help slow your heart rate. They kind of keep that sympathetic system, that fight or flight response, calm and tame, and that affects blood pressure. There's a class of medications called ACE inhibitors, which work on the kidney's mechanism for regulating blood pressure. Then there's diuretics. Diuretics, we talk about quote unquote water pills. These medications play a role in helping get rid of the excess salt that can build up, whether it's from diet or our body is retaining it for whatever reason, and that can help lower blood pressures. Those are the common medications. There's medications called calcium channel blockers that help our blood vessels relax. That helps to lower blood pressure. We have understood over time that different people respond to different medications. Different ethnic populations may benefit from one versus the other, and we have to recognize that we may be using these medications more in that type of population than another. But I think that these are the 4 or 5 classes. And then there's class 6, 7, and 8 as well. These are medications that we use when the traditional medications don't work. And sometimes we refer to these patients as resistant hypertension. Resistant meaning that we're giving them standard therapy, but their blood pressure isn't coming down. And there are ways to look into why that may be the cause.
So excellent. So we've had an expose into medications, lifestyle, whether it's smoking, exercise, diet, but any technological advances, and whether it's measuring blood pressure at home or wearables that you've found, and maybe you have some show and tell that could help people at home to even identify, correct me, but I think one of the biggest challenges is people may not even know they have high blood pressure.
Absolutely.
So they go to the dentist or they're scheduled for surgery, for example.
Exactly. So yeah, about 1 out of every 5 people who have high blood pressure don't even know that they have high blood pressure. And that's very important to know. So how do we tell? I mean, I think that I want to introduce a few terms. Number 1, when a patient comes to the office, we're taking their blood pressure and sometimes it's high. We're shocked that, doctor, I hear this many times, that doctor, I'm surprised I have high blood pressure. It's always normal at home, but it's high in the office. That is what we refer to as white coat hypertension. And that's why I didn't wear a white coat today. But white coat hypertension is something that's real. And then there's some people's blood pressure is normal in the office, and they walk home and they go home thinking that, hey, my blood pressure is fine, but they don't realize that their day-to-day activities is causing elevated blood pressure. That's what we call masked hypertension. And that's important to know. So how do we sort of bring the ambulatory clinic blood pressures and the home blood pressures together? We have to sort of have a fine balance. We need to check the blood pressures regularly in the office. We need to have a mechanism where people can check their blood pressures at home. I think that short of us putting on a patch on a patient or having a wearable monitor that we can record their blood pressure, every hour or every 15 minutes to get to know their blood pressure. But I believe that a simple $20 blood pressure machine, I purchased this for $20 and I use it all the time. My family uses it, and anytime we're free and we're sitting around, we'll check to see what happens to my blood pressure after exercise. What happens to my blood pressure after having a cup of coffee? When is my blood pressure highest? In the morning when I wake up or when I sleep? These machines are quite nice because you can record the blood pressures, it memorizes the blood pressures, you can log it, and you can share that with your doctor, and your doctor can not only advise the type of treatment you need, but the timing of treatment as well.
That's interesting. And part of what we've always tried to say is that we want to empower the patient to be part of not just the decision making, but their own treatment algorithm, if you will.
Absolutely.
So talking about the patient and wearable devices, et cetera, how do you help with adherence overall, right? So maybe one medication to, we know that's very hard to adhere long-term to treatment plan. So what do you say to patients who may be struggling right now with, who are already diagnosed, but struggling with keeping to their treatment plan?
I think it's encouragement. We have to encourage. And in order to improve adherence, patients have to know that the treatment that they're on is working. One of the most important things that I tell my patients is that sometimes blood pressure can be elevated and you may not know it. You may not feel it. If I were to go into the future and show them what can happen to populations of patients that have blood pressures even 20 points, 30 points higher than normal, if I start to gather the numbers and the statistics of stroke and heart attacks and blindness and kidney disease, it's very surprising. So the medication may not make them feel better, but it'll definitely prevent a disastrous consequence. More importantly, are we taking blood pressures the right way? What is the way? And it's another important thing is that when they're in the office, did you know that if you have a conversation with anybody while you're taking your blood pressure could be 10 or 20 points higher. If you had a cup of coffee 30 minutes before you take a blood pressure, it may be higher. So in order to take a proper blood pressure, you need to have at least a 2 to 5 minute resting period, turn the lights down, have the feet planted to the ground, have your arm resting so it's not elevated, and have it at the same level at the heart, and then check your blood pressure. Repeat that in another 2 minutes. Repeat that in another 2 minutes, and take an average. That could be your blood pressure.
Well, thank you. We'll leave our viewers with those words of wisdom from Dr. Pragnesh Gadhvi. Thank you so much for coming to the show, and thank you all for tuning in to Hudson Health.